10 fattest countries in Europe. Americans aren't the only ones with weight problems. According to a report released Tuesday by the World Health Organization, 59% of European adults in 2014 were overweight or obese, putting the region just behind the Americas, whose rates are at 61%. Here are the top 10 list of the fattest countries in Europe. 10. France. Obesity in France has been increasingly cited as a major health issue in recent years. It is now considered a political issue, whereas before it would have been an issue reported on television talk shows or in women's magazines just a few years prior. France became the first European Union country to state that childhood obesity rates have started to level off, while drastic increase in childhood obesity rates continue in most European countries. France is approximately ranked in the middle European childhood obesity rates rankings. Researchers have said this is caused from government policies, a growing awareness of the dangers of obesity, and the fact that children are eating less. McDonald's is more profitable in France than anywhere else in Europe. Sales have increased 42% over the past 5 years. Some 1.2 million French, or 2% of the population, eat there every day. Based on World Health Organization (WHO) data published in 2014, 23.9% of French adults, age 18 plus, were clinically obese with a body mass index (BMI) of 30 or greater. The data showed the incidence of obesity in French women in 2014 was 24% and among French men 23.8%. 9. Spain. Adult obesity rates in Spain are higher than the OECD average, but child rates are amongst the highest in the OECD. 2 out of 3 men are overweight and 1 in 6 people are obese in Spain. 1 in 3 children aged 13 to 14 are overweight. The proportion of adults who are overweight is projected by the OECD to rise a further 10% during the next 10 years. Social disparities in obesity are very large among Spanish women. Women with poor education in Spain are 3.5 times more likely to be overweight than more educated women. Disparities are substantially smaller in men. Higher peaks of the problem are identified between 9 to 13 years among boys from a low socioeconomical background. The analysis of determinants of obesity in Spanish children and young people show that overweight and obesity is related to absence of breastfeeding, low consumption of fruit and vegetables, high consumption of cakes and buns, soft drinks and butchery products, low physical activity levels, and a positive association with time spent watching TV. The joint consensus document, produced by the Spanish Association of Pediatrics, APE, Spanish Society of Community Nutrition, SNC, and Spanish Society for the Study of Obesity, CITO, considers a global strategy for the prevention of obesity from early stages in life. The important role of the family and the school setting, as well as the responsibility of the health administration and pediatric care in the prevention of obesity, is highlighted in the document. An investigation by the Mar de Barcelona Hospital has found that 80% of men and 55% of women will be overweight by 2030. If the current trend continues, the researchers write, within 11 years more than 27 million people in Spain will be overweight. 8. Slovakia. In Slovakia, 25% of the adult population, over 1 million people, are living with obesity, and more than 1/3 of the population is overweight. 5% of children suffer from obesity, 12% are overweight. Children have the option of treating obesity through their pediatrician and endocrinologist, or other specialists. Obesity treatment for children is covered by public health insurance. General practitioners, diabetologists, internists, and endocrinologists are treating diseases associated with obesity. Slovakia has shown limited progress towards achieving the diet-related non-communicable disease (NCD) targets. The country has shown no progress towards achieving the target for obesity, with an estimated 21.7% of adult, aged 18 years and over, women and 23.3% of adult men living with obesity. Slovakia's obesity prevalence is lower than the regional average of 25.3% for women and 24.9% for men. At the same time, diabetes is estimated to affect 6.8% of adult women and 9.3% of adult men. 7. Poland. According to 2018 data from Poland's National Institute of Public Health, excessive body weight among Polish children has risen by 130% since 1990. Few other countries in Europe have been scaling childhood obesity rankings as quickly. The National Health Fund of Poland claims that approximately 68% of Polish adult men and 53% of women are overweight, and that 25% of Poland's entire adult population is obese. If current trends are maintained, there is a risk that their children will live shorter lives. According to estimates for the Organization for Economic Cooperation and Development, OECD, life expectancy in Poland, currently 78, will fall by 4 years by 2050, largely because of obesity-related issues. The rate at which Polish children are becoming overweight and obese is very worrying, says Paweł Bogdanski, head of Polish Association for Obesity Treatment. The situation in Poland is truly unprecedented. It's a threat we've never faced before. 6. United Kingdom. Obesity in the United Kingdom is a significant contemporary health concern, with authorities stating that it is one of the leading preventable causes of death. In February 2016, former Health Secretary Jeremy Hunt described rising rates of childhood obesity as a national emergency. The National Childhood Measurement Program, which measures obesity prevalence among school-age pupils in reception class in Year 6, found obesity levels rocketed in both year groups by more than 4 percentage points between 2019-20 and 2020-21, the highest rise since the program began. Among reception-age children, those aged 4 and 5, the rates of obesity rose from 9.9% in 2019-20 to 14.4% in 2020-21. By the time they are aged 10 or 11, more than a quarter are obese. In just 12 months, the rate is up from 21% in 2019 to 25.5% in 2020-21. Causes cited for the growing rates of obesity in the United Kingdom are multiple, and the degree of influence of any one factor is often a source of debate. At an individual level, a combination of excessive food energy intake and a lack of physical activity is thought to explain most cases of obesity. Reduced levels of physical activity due to increased use of private cars, desk-bound employment, a decline in home cooking skills, and the ready availability of processed foods high in sugar, salt, and saturated fats are variously cited as contributing factors. 5. Czech Republic. The Czech Republic had the second highest rate of obesity in Europe in 2015. 28.7% of the adult population had a body mass index of 30 or more. 6 out of 10 Czechs are overweight, and 1 in 5 is obese. Nearly 70% of Czech men are overweight, while half of women have a BMI of over 25. 4. Israel. According to a report by the National Program for Quality Indicators in Community Healthcare covering the years 2015 to 2019, the researchers found that about 62% of men and 55% of women ages 20 to 64 in Israel were overweight or obese, and that the numbers are trending upward. Moreover, almost 1 out of 5 Israelis smoke, and 1 out of 10 has diabetes. 3. Malta. Obesity in Malta is a contemporary health issue. This problem is connected to several other illnesses and economic costs for the government. The causes for Malta's obesity are various, and one of the leading aspects is physical inactivity. With 26%, meaning 1 out of 4 adults, being obese, Malta is far ahead on the obesity scale, comparable to other EU countries. For children, the situation is worse in Malta, as 40% of all children are obese there. 2. Turkey. Turkish population has higher obesity prevalence than most of the European countries. Overall, it was found that 56% of Turkish population is overweight while 41% is in the normal range. The reasons for high prevalence of obesity in Turkey may be an increasing sedentary lifestyle in the cities and dietary habits in Turkey. Other factors may also be effective, such as societal changes and technological developments. 1. Andorra. Andorra has shown limited progress towards achieving the diet-related non-communicable disease (NCD) targets. The country has shown no progress towards achieving the target for obesity, with an estimated 26.7% of adult, aged 18 years and over, women and 28% of adult men living with obesity. Andorra's obesity prevalence is higher than the regional average of 25.3% for women and 24.9% for men. That's all for our top 10 list this time. While European men are more likely than women to be overweight, women are more likely to be obese. When broken down, 58.6% of European adults are overweight and 23% are obese. Thanks for watching.